I'm David McNeil. I'm the President and Chief Executive Officer of the Brant Community Healthcare System. Since I arrived in December, I've had the opportunity to talk with hundreds of people inside the organization and outside the organization. I've had the opportunity to listen to you and hear about the things that are going well, some of the challenges, and what your aspirations are for the Brant Community Healthcare System in the next 5 to 10 years. As I talked with people internally and externally outside the organization, I heard one thing, that Brant Community Healthcare System has great people, and I would agree. Brant Community Healthcare System has committed professional staff, nurses, doctors, support staff, and volunteers who are all committed to providing excellent patient-centered care. This doesn't mean that there weren't opportunities identified for improvement. In terms of what it's like to work at Brant Community Healthcare System, I heard two lines of thinking. First, people were happy that things were moving forward and that we could put some of the past challenges behind us. There was recognition that we're on the right track and things are much improved. However, there were some people that thought things were still stuck and that there was an inertia to move things forward. My conclusion is the transformation is not yet complete. Although our changes won't happen overnight, working together, we can make a difference. Our goal is to make the Brant Community Healthcare System a local employer of choice where people want to work and stay. It is important that we are culturally sensitive to all those who come through the doors of the Brant Community Healthcare System and people within our community. Our board chair, Paul Emerson, and I had the opportunity to meet with the leadership at the Six Nations as well as Mississaugas of the Credit, understanding our local Indigenous history and providing a safe place where Indigenous people can receive care at the Brant Community Healthcare System, while still listening to understand their concerns and how we can improve that care is a priority. We've taken some immediate steps in this regard. We've started to provide cultural safety training to all physicians, staff, and volunteers at the Brant Community Healthcare System. We also have two wonderful Indigenous board members who are providing governance oversight to the hospital. I will also be joining the Indigenous Patient Experience Working Group to ensure that it has the resources that it requires to be successful. This is some of what I heard in my first few months at the Brant Community Healthcare System. I'm excited to hear about your feedback, and please stay tuned for our next video.